Hello, and good evening once again. Dr. Alalade here at Ask the Gynecologist. Tonight, I'll be talking about a very special topic: cervical stenosis and uterine synecdoche. So, um, I'll tell you the reason why I chose this topic later on, as soon as we have people joining. And I can see Oladokun Patricia 67 already on Instagram. Very wonderful lady. She's already online and she's listening and following us. ATG, as you may know, stands for Ask the Gynecologist, and it's one of your biggest groups on Facebook where we discuss female gynecological problems and we try to ensure that people get answers to their problems. My name is Dr. Alalade. I'm one of your admins here at Ask the Gynecologist, and I'm so happy and thrilled to be here. I can see Adeyemo Bukola. I think that's my cousin. She's already on Instagram following us, and also other people joining in on Instagram and Facebook. And see Vivian Deco Briggs, Christina Idowu Adeyemi Akomu, and these are our wonderful, beautiful moderators on Ask the Gynecologist. And I can see Chinenye and others as well. If I have not mentioned your name, please say something so I can know you're there and I can recognize you before we start this discussion. Chinenye Anyawezema, thank you so much, my wonderful sister. Adiola Ogumola and Kids.ng, sweet damsel. Oyewumi 23, sweet damsel. Thank you. Good evening on Instagram. How are you? My name is Dr. Alalade, and I'm so happy to be here. And let me tell you something. I wasn't able to be live yesterday as I came back from work at 10 p.m. And trust me, I was just exhausted. And I just had to eat something, then go to bed straight away. Wake up this morning, back again at work. But in all, I give glory to God, because sometimes it's not just about coming here. It's coming here to give something to you guys. As you listen, you get answers to your concerns. Julie Anyebe, Marianne Ajam, Matthew Stella, Akin Dutire, Esther Additional, ST Kingsley, Uka God, Nadema, Gladys Eze, Onyere, Chinenye, thank you so much, guys. Olufumlayo Ojo, Ude Stella, Sheon Adegboye, Folashade Gomez, thank you. Akin Dutire, Esther Additional, Betty Lily, Spirals Hair, Saha, Deluxe Souvenir More, and Evangelist Gloria Maka, Queen Esther, priceless, wonderful. Once again, my name is Dr. Alalade, and ATG is my home, as ATG is your home, and I'm so happy and delighted to be here. Today, I'll be talking about cervical stenosis and what is uterine synecdoche. Uka God, she says she wants to chat with me privately. Please, moderators, kindly help me assist Uka God to know how to subscribe for our premium services. Roda Ogboge, Ellen Ubonaya, Bold Exquisite, my wonderful cousin. How are you? Olayi Okunla Karimot. We have Jenny Abe 2018 apologies, Basira Afolayan, and we have Ukwa Mo Chelsea on Instagram. Cynthia Du, Olaiton Lufunke BME. Thank you guys. Nadozie Peace Onyedikechi, Olaiton Lufunke BME. Ayo Pedro, my wonderful Ayo Pedro, where have you been? Ayo Pedro, we've missed you so much here, and I hope you're doing fine. Awoyemi Funke. Olayiwola Okunla, good evening. Karimot, good evening. Tina Onyeka Philip Nwakolo. So guys, let us start. As I talk, I'll keep recognizing names as people join. Oluwafisayo Mimerio, Ude Stella. Guys, let us start. So, first of all, your first question will be, okay, what is the cervix? I'm going to bring this model close to the screen as I talk, okay? Now, this is the womb. By now, every member in ATG should know what a woman's womb looks like. This is what a woman's womb looks like, as big as my fist, when the womb is not pregnant. When you're not pregnant, your womb is as big as this. Okay? And the womb, if you know this particular fruit called pear, okay, pear, that is the exact shape of a womb. A womb is a pear-shaped structure. And if you've seen pear before, that is exactly what a womb looks like and what a womb feels like, to be honest. And that womb, okay, that top portion of the pear is the opening of the womb called the cervix. And the cervix is what you feel. Hello, Bimbola Oluwa Shion Babalayemi. How are you, my sister? wonderful sister. We grew up together, and we're always coming back with the same school bus to home all the time, and went to the same church. Thank you, Abimbola. God bless you. So if you want to know what the cervix is, the cervix is that part of the womb that opens, that allows babies to come out whenever you are having baby vaginally. And to feel the cervix, okay, if you put your finger into your vagina, at the top of vagina, you will feel a soft substance, as soft as your nose, okay? It has a tiny opening. Sometimes, in most cases, it is closed. That is the cervix. It's called cervix because that is, if you look at the pier, okay, and that pier, you hold the neck. The opening of that top part of the pier is the neck of the pier. It's the same thing, the neck of the womb. Cervix is called cervix. Neck in Latin is cervix. Cervix. Whenever you hear cervix, okay, is the neck. Whether it's the cervical region, cervical bone in the neck, or the cervix of the womb, that is so to say, the cervix is the neck of the womb, okay? And that is what you feel when you put your finger into your vagina deep in, and that cervix is what opens to allow baby to come out. The cervix is what we also take smear from, what we call pap smear or cervical smear. That is the cervix where your doctor uses that brush to collect the cells to check for any sign of cancer in your cervix. Is the same cervix, and that's what opens to allow baby to come out, okay? Now, what is cervical stenosis? Stenosis means blockage. What can cause cervical stenosis? What can cause blockage of the cervix of the womb? And what is uterine synechia? That is the topic for tonight. Blockage of cervix, what will cause it, and what will cause synechia, and how does cervical stenosis cause infertility in the woman. Now, before I continue, this Saturday I'll be talking about how to use Clomid, how to track your ovulation properly, and how to ensure you get pregnant by using these simple things, okay? And how to ensure you get the best IVF outcome if you need one. If you've not joined that seminar group, which is this Saturday, this is the time for you to now join the seminar group. If you're a Diamond subscriber, request for the link to join the seminar. Send a request to my WhatsApp number. If you're a Diamond member, you're a Gold member, that means that you already have my WhatsApp number. Just send me a text. Doctor, I need my access to my seminar of this Saturday, and I'll send it to you now. If you are not a member, Gold, Platinum, Gold, or Diamond, now it is time for you to join that seminar today without wasting time. So what will cause Favor Anointed? I can say Aduke Farms. I can say you Alva Bold, Zenira, Spirals Air. To register for the seminar, please, can somebody help me attend to Spirals on the Instagram page? She wants to join for the seminar. She's asking for the fee. The fee is two grand. And can somebody give Spirals or post on the Instagram page how and what is the link to join the seminar page? Thank you. So, like I said again, if you just joined me, I'm talking about cervical stenosis today and uterine synechia and how it can cause infertility. So if you're just joining me, welcome once again. My name is Dr. Alalade, and let's start. So, like I said over the last few seconds, the cervix is what opens into the vagina. Okay, cervix is the topmost part of a vagina, and the cervix is the door entry into your womb. Okay, any infection in your vagina, okay, potentially bacterial infection or whatever you have, has a potential capacity to move into your cervix, into your womb cavity, and can cause infection in your tube, in your womb. Any infection in your womb has also the capacity and capability to move into your tubes on either side and cause PID. That is why I tell every woman listening to me today all the time on ATG that always treat your vagina as an open wound. Treat your vagina as an open wound. If you know your vagina is an open wound, then you not put anything stupid or nasty or dirty into your vagina. Okay? So treat your vagina as an open wound. Now, any potential instrumentation in your cervix, for example, you've had a previous DNC, okay, which was not done properly. You've had a previous cervical fibroid, which was removed by operation. A previous cervical polyp, which was removed by twisting or pulling or operation. You've had a previous DNC, like I said, previous infection like chlamydia, gonorrhea, All these things has potential of causing blockage and damage and blockage to your cervix, making your cervix tight, not able to open, not able to allow your menstrual blood to come out or sperm to go in. So cervical stenosis will prevent sperm from going in and menstrual loss from coming down, and your old menses, your old menses, everything collects in your womb, and it can cause problem. Now, this is not bad blood though, so don't start getting it wrong. Let's forget all those things that people say in Nigerian buses. Hey, you have bad blood, your period is bad blood. That is not bad blood. Okay, cervical stenosis is different. Okay, and there's nothing called bad blood anyway. Just for your own consumption. There's nothing called bad blood, okay? I'm talking about cervical stenosis. Now, if you've had bad cells on your cervix and your cervix was treated by what we call LETZ, LETZ, that is large loop excision of transformation zone on your cervix, because there were bad cells there. We excise a portion of your cervix. The cervix becomes very short, closes, and also forms like some scar tissue. It can be closed and blocked. That can also cause cervical stenosis. Okay, now what do we do if you have cervical stenosis? We can do what we call cervical dilatation, where we try to open the cervix, and in some places after they've done the cervical dilatation, they now leave a coil in your cervix or in your womb to keep the cervix open. That is, or some people even leave a balloon there for a couple of hours or days. I don't know how effective that is, but as far as it's safe, doesn't do any harm, that's fine. But if you have blockage in your cervix and you want to do cervical dilatation, ensure you go to a proper doctor that knows the anatomy of the cervix well, because by trying to open the cervix, there's a potential risk of damage, causing perforation in your womb, perforation in your cervix that can cause damage or perforation into your bowels, into your intestine. So whenever you want to do cervical dilatation, please listen attentively to me. If your cervix is blocked and you want to unblock it by doing cervical dilatation, it must be done by somebody that has proper experience and expertise to dilate the cervix, because there's potential risk of damage to the womb, causing uterine perforation, causing cervical perforation, and risk of bowel injury and bowel damage. And if there's bowel injury, bowel damage, it can cause death. That is why wherever you want to go for cervical dilatation to unblock your cervix, you must ensure that that person has a capacity to do hysteroscopy, to look into the womb cavity in case of any possible or suspected complication during the procedure to unblock your cervix. Okay, even if you have a D&C done before, if you've had previous treatment on your cervix, your period is scanty, there's a potential risk that your cervix could have been stenosed or blocked. How do you know if your cervix has been blocked? What you usually notice is that, now, these are possible signs. I'm not saying that if you have these things I'm going to mention, that automatically you have blocked cervix. I'm not saying that. I'm only saying that the things I'm going to mention now, if you have them, there's a potential capacity or possibility that you might have cervical stenosis. Now, number one, your period normally flows before. All of a sudden, listen to me, all of a sudden you went for a procedure, maybe to do D&C, to do say large loop excision or treatment on your cervix. You had a polyp removed in your cervix, fibroid removed in your cervix. Suddenly, 2-3 months down the line, after everything should have settled down, your period does not flow as expected. Your period is now becomes scanty. After 2 or 3 months, you complain to doctor, they did the scan, everything's okay, but your period becomes scantier and scantier and now very light. That could be a sign or potential sign of blockage in your cervix. Number one. Number two, usually around the time of your period, you have so much pain, and the pain is getting worse month in after month in. Usually after a particular procedure done on your cervix, like maybe you had an infection in your womb, you had a D&C, you had a C-section. Suddenly 2 or 3, 4 months down the line, your period starts to become scantier and scantier. Those could be potential signs that your cervix is blocked. Okay, or sometimes too, if you've had all these things done, maybe previous D&C, previous treatment on your cervix from bad cells on your cervix, previous infection, all of a sudden your periods become scantier, and during your period time, there's so much pain in your tummy. You've done a scan and we can see some fluid or collection in your womb. those could be potential signs that your cervix is blocked or has been blocked, okay? So what I'm trying to say is that your cervix does not just get blocked. There must be an antecedent history. There must be some secondary change in your history or factors that will have possibly pointed to the fact that your cervix is blocked because your period was normal before, now it becomes scanty. Now, if your period was normal before, now it becomes scanty, it does not always mean that your cervix is blocked. It could just mean that probably you're not ovulating anymore, or you're going through menopause, or so on and so forth. So just because your period is scanty does not automatically mean that you have cervical stenosis. It's just a possible sign that we doctors now need to investigate further and ask for that question. Okay, if you have any question, hold on, let us finish. Okay, if you have questions, hold on, let us finish, and I'll take questions one by one, one after the other. Okay, now another thing I wanted to mention today is uterine synechia. Uterine synechia basically is a big Latin word meaning that you have scar tissue in your womb. So like cobwebs and scar tissue, like scar. You know, when people have a cut on their body and they heal, there'll be scar tissue like keloids or like that. So something like that, there's bad scar in your womb cavity. What can cause uterine synechia? Now listen. C-section is unlikely to cause uterine synechia. Okay? However, if you had a D&C where we had to scrape your womb cavity, you have so much polyps in your womb, everywhere in your womb, many polyps in your womb, where we had to remove all of those multiple polyps, okay, those things will make your womb scarred and scraped. Sometimes you had a D&C after the doctor has removed the pregnancy or done an abortion for you, whatever they call it. They now scrape the womb wall to ensure that there's nothing left of pregnancy inside your womb. That scraping is okay, but if it's done too much, it can cause too much injury to your womb lining. And when your womb lining starts to heal, it can heal on itself and it causes uterine synechia and your womb cavity is blocked. The womb cavity is supposed to be open always like this, but when you have those treatments on your womb and the womb cavity is healing with all those scraping and those scrapings, you can make the womb cavity to heal and all the womb becomes closed and everything is stuck together and there's no free flow of sperm to move in or of period to come out. And you do a scan, you see pockets of period collecting, blood collection in the womb cavity, or the person is going through period when they cannot get pregnant. Those could be signs of possible uterine synechia being found. How do you know for certain that a woman has uterine synechia? So from the history, the person comes to you, their period was flowing good, suddenly they had a D&C, just like the case of cervical stenosis, they had a D&C, the period now becomes scanty and scantier. There could be an evidence of uterine synechia. They've gone for scan, you can see so much fluid collection in the womb cavity. Those could be signs of uterine synechia. So what we do is that to be sure, we now do hysteroscopy, where we put a camera in from the vagina into your womb cavity to look into your womb. And if we see any scar tissue in your womb cavity, we remove them gently, professionally, and we cut them open with scissors or with graspers or whatever you have. Doctor-wise, remove them and allow your period and your womb cavity to become more patent, open, so that period might flow out easily, and also sperm can go in easily as well. If you have synechia, some people it can be so bad though, and then they cannot get pregnant because the sperm cannot enter. I've seen that before. It's not very common, but it can happen. Okay, so if you're trying to get pregnant, pregnancy is not forthcoming, you've done all the test of semen analysis, okay, you're ovulating, okay, your periods are regular, okay, your periods are becoming scantier, it's time to do ultrasound scan, and also consider doing hysteroscopy to look into your womb cavity to remove any scar tissue that could be in your womb, blocking the womb, okay? So that's uterine synechia. Now, it's not very common. Uterine synechia can also happen, yes, from infection. Some people can have so much bad infection in their womb cavity that can cause what we call endometritis, and it can also lead to uterine synechia. It's very uncommon, but it can happen. Basically, uterine synechia is scar tissue in your womb cavity. Okay, I'll take some questions quickly, and then I'll continue our discussion tonight. Okay, so let's take some questions tonight quickly. before we lose track. So Carol Gabriel, good evening to you. Your baby is doing fine. My baby is doing fine. Thank you so much. Thank you, Alalade Moye. I can see you on Instagram. You're already answering our people on Instagram. Our FFP, Zibri Organics, Oba Free. Thank you. Now, let's take questions here on Facebook, because people are already itching and they are getting angry that we've not taken questions. So I'll take some questions now. Yeah, let's do. Quick. Questions coming, and let's continue. Questions coming, answer come out. Questions coming, answers come out. Questions coming, answers come out. Yes, guys, ask simple and straightforward questions, okay? Don't ask questions for your cousin or for your church member. Ask questions for yourself. What can stop period, sir? What can stop period? What do you mean, what can stop period? You're having heavy period. If you're having heavy period, we do a scan to know what is causing your heavy period, and we can give you some medications to stop your heavy period. You've done 4 IVFs, you got pregnant once, miscarried, you did hysteroscopy in 19, everything was good. What do I think is the problem? You used egg donor the last IVF, they did not work. It could be transplant failure, or probably we need to use a different protocol for your infertility, okay? Is there any simple test to determine if one has cervical stenosis? The test is that we do hysteroscopy. That's a simple test, hysteroscopy, okay? Is there any test to determine? Okay, I've already answered that question already. There's somebody here, emotionally, she's asking how to join premium services. Please attend to her. She's on Instagram. Thank you, guys. There is another question here. Is there an automatic danger to the baby of a pregnant woman who already is in her second trimester, did not vomit, taking balanced diet, never had folic acid? There's no problem. Folic acid is a supplement, okay, to prevent neural tube defect. And the neural tube defect that folic acid is preventing is prevented before pregnancy up until 12 weeks of pregnancy. By the time you pass week 12 for pregnancy, folic acid is not really doing any prevention anymore. If you're already in your second trimester, you can stop the folic acid, okay? Now, in most cases, your diet will contain the folic acid you need. But if you've missed that time, you didn't take folic acid before pregnancy, and in your first 12 weeks of pregnancy, you can't change time. But as far as you're having balanced diet, it's all chance that your baby is okay. So do a scan at 20 weeks to check your baby. What can cause fibroids? Honestly speaking, we don't know what causes fibroid. We don't know. But it's very common in African population, Afro-Caribbean population. But we don't know what causes fibroid itself. Nobody knows. Okay. Thank you, Shade Gomez. I can see your response here. Thank you, Shade. Yep. Cynthia Do is asking, laparoscopy, is it also an IVF procedure? No. Laparoscopy is not an IVF procedure, but it can be done to check for problems before IVF. Laparoscopy can be done, is done to check, basically a camera to look into your tummy, to look at your tummy, anywhere in your tummy, especially for gynae problems, to look into your, or look around your womb, ovary, to see if there's any obvious gynecological problem, which we can treat before you go for IVF. Okay? So laparoscopy is not part of IVF, but we can do it before IVF if we are looking for issues that may have caused failed IVF before, or we're trying to check for other things that could make IVF not work out. I was diagnosed with cervical stenosis, but newly married, no operation done on me. Yeah, if you have cervical stenosis, we can just simply do cervical dilatation to unblock the cervix. Is pregnant care conception good for fertility boost? Pregnant care does not boost fertility. If you think, or they've told you before, that pregnant care will boost your fertility, you've been told or sold a lie. If you've been told before that pregnant care is to boost your fertility, you've been told a big, fat, beautiful lie. Okay? Pregnant care is only designed to prevent neural tube defect in baby and to supplement any other vitamins that you need in pregnancy. So, Osakwe, Jessica, that's the answer to your question. Is it advisable to be taking folic acid even if you intend to go for IVF? Yes. If you're going for IVF, please be taking folic acid. Yes, it's important. Important stuff. If you're going for IVF, you should be taking your folic acid. T.Y. Bella Freeborn, you've not done any DRC before, neither have you gotten pregnant before. You said something that you interested of, said blah, blah, blah. Little boxes. I don't understand what you're saying. I don't understand what you're saying, TY. What little boxes? Little box. I don't understand what that means. Can I open a cervix that is blocked? Yes. If your cervix is blocked, it can be opened by cervical dilatation. Doctor, what makes somebody to be spotting more than 1 week after IUI? Possibly risk of miscarriage. 1 week after IUI, you're spotting, there's a chance that you might be miscarrying that baby. So go and do your test of pregnancy and get a scan. Well, a scan won't show pregnancy at 1 week anyway, but go and do your test of pregnancy, okay? Fluid collection in the part of Douglas, same as fluid in the womb? No. Fluid collection in the part of Douglas is different from fluid collection in the womb. Fluid in the womb is fluid in the womb. Fluid in the part of Douglas is fluid behind the womb, okay? Is it possible to see period and not ovulate? Yes, Evelyn, it's possible. What food can a pregnant woman afford? Any food, as far as it's balanced diet. You said inside the vagina. What happened in the vagina? I don't know what that means. What's your question? Does folic acid increase growth of fibroid? No. Folic acid does not make fibroid grow. What is chemical pregnancy? Basically, you're pregnant. Your test of pregnancy is only positive when you do a test of pregnancy, but it's still yet to be seen on scan. That's chemical pregnancy. But with time, chemical pregnancy will become obvious from 6 weeks onwards, okay? Thank you, Alalade, for putting up the address of the IVF center on Instagram. If you want to do IVF and you've done 3 IVF that has failed, I think you should come and check us at the ATG IVF center tomorrow. Tomorrow, call my secretary. She will tell you how you can get set up for your IVF treatment to ensure you get pregnancy. If you've done IVF before, 1 time, 2 times, somewhere else, and you failed, it's time to turn your situation around. At the ATG IVF center, you'll be amazed at the team of ladies we have there that they will make your life the best and to make you comfortable throughout your IVF journey so you can carry your own child home. Try and call the ATG IVF center and they will walk you through tomorrow. TY Bella Freeborn, what causes chemical pregnancy? It's just pregnancy, okay? TY Bella is asking, you said inside the vagina. What is in the vagina? I don't know what that means. Put your question up again, okay? Put your question up again, okay? Doctor, please, what kind of test can go after 2 miscarriages? You can, ideally, after 2 miscarriages, we don't do any test. We don't start doing tests after the 3rd miscarriage because most people can have 2 miscarriages and there's not an issue. But if you have 3 miscarriages in your row, they will start doing tests to check for antiphospholipid syndrome as soon as possible. You can get that done at the ATG IVF center as well, okay? Can one with chocolate cyst get pregnant? Yes. What is the cause of pain in lower abdomen after menstruation? Maybe endometriosis or maybe fibroid. There's a question here by Spiral said, please, doctor, is there anything that can be done after stimulating my ovary, getting trigger shot and ovulation confirmed boost implantation? Is there anything that can be done? Spiral said, I don't understand your question on Instagram. I don't get it. Kindly retype it. Is there any way IVF can be achieved in 5 weeks? To an extent, yes, but I can't guarantee. I suggest work for at least 6 weeks to be in Lagos at our IVF center. You want to do IVF, be in Lagos at our IVF center for around 6 weeks, okay? You said there will be little ball inside. I don't know what you mean, TY Bella. Maybe you've been asking a question before, but ask it all over again because if you're, this is a big group, okay? So if you think I'll remember what you wrote on the text, on this text, maybe some few seconds ago, I can't remember because I'm answering so many questions at the same time. So it's not a chat room. Just text your question and let me answer your question. TY Bella, okay? Candida crusade, can it cause sperm not to enter vagina? No. Candida does not stop sperm from entering your vagina. Nifemi Adebola, thank you so much on Instagram. Welcome. What is the risk of ovarian cyst? Ovarian cyst can cause torsion. Ovarian cyst can twist on itself and can cause pain, what we call torsion, and it can damage the ovary. That's the risk of ovarian cyst. Okay? How can I open my cervix? You can do cervical dilatation. That is if your cervix is blocked. But if there's no blocked cervix, so don't go and start puncturing your cervix. So because trying to open your cervix by anybody that does not know what they are doing can actually cause more damage and can kill you. So we only open cervix that is blocked though. Don't go and say that Alalade said you can't open your cervix. I didn't say you should open your cervix. So if the cervix is blocked, we can open it through cervical dilatation. Okay? Don't go and say Dr. J says you can open your cervix, so I didn't say that too. I'm only saying that if your cervix is blocked and you've been told by a doctor that it is blocked, they can unblock it through what we call cervical dilatation. Okay? Cervical dilatation must be done only by a professional doctor, gynae, because There's a risk that they might perforate your womb, they might perforate the cervix, or they might even perforate or damage and puncture your bowel, which can kill. So be careful. Good evening, doctor. For one not seeing ovulation, what is the cause? Maybe you have hormonal profile imbalance, maybe hypolectin, maybe abnormal testosterone, maybe abnormal FSH. Those are possible things, okay? You've used packet of Palodel, but you still see mucus discharge from your breast, then you need to see endocrinologist. Okumala, you must be seen by an endocrinologist to check why your body is not responding to this medication to bring your prolactin down. Can I take folic acid with other medication? Yes, if you are okay with it, that's okay. It does no harm. What causes vaginal dryness? Low estrogen, high FSH, menopause, poor foreplay, stress can cause vagina to dry. Doctor, can I take folic acid with other? Yeah, you can take folic acid with other medication. You can take folic acid with other medication. It's safe, perfectly okay. Yes, you can take folic acid with other medications. Doctor, if you are given 2 embryo and implantation is successful, does it mean all the 2 embryo are implanted or only one? Is difficult to answer. Because if you put 2 embryo in, one might implant and one might fail. True. That's the essence of putting 2 in the first instance, because you want the 2 to be successful, or at least if one fails, you have one sure banker on the side. Now, to know which one implanted, I don't know, it's difficult. And sometimes only one might implant, and that one will divide again into 2. So you had 2 implanted, one failed. The one that got through can even divide into 2 and become twins. So it's difficult to know. Can a 4 centimeters of mucous fibroid be used for IVF? Yeah, I'll suggest you remove it. If you have a fibroid 4 centimeters in your womb cavity, remove it before IVF. Doctor, what test can I do spotting a week after IUI? Do test of pregnancy, okay? And also get some cyclogen as well. My own uterus and AK block my uterus entrance inside. Although my period is normal, can I conceive naturally? Clear out the uterus and AK, okay? Go and clear it out. Go to ATG IVF center, tell them you want to do hysteroscopy, and they'll give you the cost to clear out any uterus and AK you have. Treatment for ovarian cysts is to remove it through surgery or leave it alone. If it's less than 4 centimeters ovarian cyst, leave it alone. But if it's causing pain because it's twisting on itself, then it has to be removed quickly. But in most cases, cysts that are less than 4 centimeters will disappear within 6 months, within 3 to 4 months, okay? Doctor, does fibroid occur only in pregnancy? Fibroid can occur at any time. Before pregnancy, during pregnancy, fibroid can occur at any time. Fibroid does not have to occur only during your pregnancy. It can occur anytime. What's the cause of spotting in pregnancy? We don't know, but when you spot in pregnancy, the number one thing that comes to mind is that, are you miscarrying? There's a question here by T.Y. Bella, okay? T.Y. Bella, let other people ask questions too. Can E. coli stop period? No. What causes spotting during pregnancy? Threatened miscarriage, risk of miscarriage, low placenta. They can cause spotting in pregnancy. That's for Kehinde Okpara. I saw T.Y. Bella's question just now, but I can't find it again. Okay. On Instagram, you've been spotting for a week. You did test of pregnancy is negative. What could be the cause? That means you've miscarried or you didn't get pregnant at all. If you had IU-high, you don't test of pregnancy is negative. That means you were never pregnant, or possibly you've miscarried 2 weeks before. So it's either you're not pregnant at all or you've miscarried 2 weeks ago. Doctor, you have idiosarcings, you've never conceived before. If you have idiosarcings and it's only on one tube, you can still get pregnant with the OK one. Once you're pregnant, we do a scan to check that you don't have ectopic pregnancy. But if you have idiosarcings in both tubes and they are blocked, you have to go for IVF, honestly speaking. That's the honest truth. Doctor, basically last month, you had your cervical period appear. It was just large blood stain, and that was at the night. And the rest of the night was no further bleeding. Okay, what's your question? Doctor, what can cause spotting within periods length and black blood 2 days before normal period? Possibly endometriosis, possibly uterine infection. You want justice. Is that normal? Every day there was no bleeding. Danny, I don't really understand your question. No, it's Danny on Instagram. I don't really understand your question. I won't lie. That question is a bit, I don't really get it. I don't get it. Can clomid be taken to boost ovulation? It can, but it must be done under proper supervision by a doctor. It's Danny. I don't really get your question. I don't really get your question at all. So I can't really answer it. I don't understand what you're saying. But if you're worried, go and get a scan done and get examined, okay? What is the medication for low sperm count? Low sperm count, we need to know why it's low. So we need to do a FSH for your husband and LH hormone, prolactin hormone. Sometimes we use Adizua to boost your sperm count, or we use Fertility to see if that can boost your sperm count. T.Y. Bella, sir, it's only when I am on period I feel around the womb. So it's so little I don't know if it's fibroid. So T.Y. Bella, why don't you do a scan now so we can check your womb? Do a scan, okay? Is bleeding normal during the first trimester? No. No bleeding is normal in pregnancy. Whether in first trimester, in third trimester, in third, whatever. And second, no bleeding is normal in pregnancy. Once you're pregnant, you shouldn't bleed. The only time you should bleed as a woman in pregnancy is when your baby is about to be delivered at full term. If you're not pregnant, the only time you should bleed is during your expected period. Case closed. Any other bleeding should be investigated. Case closed. Thank you, Liz Queen, for moderating here on Instagram. Thank you so much for telling Daniel what to do. If someone put to birth and lose the baby, like how much should that person start again? Give yourself about 2 to 3 months, okay? But the most important thing is that you are healed physically and you are also healed emotionally. Wait for yourself to heal physically. Don't start rushing to get pregnant after a miscarriage or after a C-section or after a normal delivery. Let your body heal before you start. Can a woman with rhesus B marry a man with rhesus O negative? Yes, you can, okay? Real Lissy, thank you so much. Real Lissy, thank you for being here. Is there any specific pre-seed lubricant friendly lubricant? Yes, pre-seed. Pre-seed lubricant is sex friendly. Pre-seed lubricant is sperm friendly. Okay? Can a pregnant woman be induced at 38 weeks? Yes, if she has blood pressure problems. Yes, if she has diabetes that is not controllable. Yes, if she has other problems that baby is not growing well. Yes, if her membrane have ruptured and there's a risk of infection. So it depends. A woman can be induced at any time. Can be induced at 38 weeks if we suspect that going beyond that is not for the woman's best interest. Okay? Is it advisable to go for test after miscarriage? For which test? I won't say go for any test. After miscarriage 1, don't even waste your money. Miscarriage 2, don't waste your money. But if you're having 3 miscarriages, that is back to back, 3 miscarriages back to back for the same man, it's time to go and get tests done, genetic tests. If you call ATG laboratory tomorrow, they'll give you all the list of tests you should do and you'll get it done as soon as possible. Can blocked tube be open? Yes, it can. 1 out of every 4 that are blocked. But in most cases, it doesn't work. We call it ideotubation, but it doesn't work in most cases to unblock the tubes. If your tubes are blocked, consider IVF ASAP. You feeling serious pain when ovulating like a week after ovulation? Is it okay? Do a scan, and if scan is okay, there's nothing to panic about. How can one cure ovarian cyst? By doing surgery to remove it. There's no medication to shrink ovarian cyst. No medication will melt ovarian cyst. Most ovarian cysts less than 4 centimeters will disappear within 3 to 4 months. Within 3 to 4 months. But most that are more than 4 centimeters that are causing pain at any time should be removed ASAP. Thank you guys for being here today. I'm exhausted. I need to go rest now. Thank you for being here, for listening to me today once again. Hopefully, I'll be here tomorrow to have a chat again with you all. And don't forget to get registered for the ovulation seminar. It's going to be a massive, massive treat. For those that attend, they'll be amazed at the things we're going to say. I can guarantee that, no doubt. So see you tomorrow again. God bless you. Love you all. Have a wonderful week. All right. Bye-bye.